A very good morning, students. This is a short video on the Bell's palsy, and this results. It is an applied importance of the paralysis of one half of the face, and this results due to the facial nerve paralysis. Okay. Now, the muscles of the facial expression, all our small muscles of including that surrounds the oral this our opening of the mouth or that of the lids. Okay, orbicularis oculi or the orbicularis oris. All these small muscles of the face or facial expressions are supplied by the facial nerve. And we know that the facial nerve is the seventh cranial nerve, and it is a mixed nerve, motor, sensory, plus it also contains fibers, secretomotor, and the special sense fibers are also there. That is a different story. Here, since we are on the topics of the face, okay, so here we will learn which are the nerves, okay, or branches of the facial nerve which will supply to the muscles of the facial expression, and why this condition called as the Bell's palsy it results. So let us first see the nerves which are terminal branch of the facial nerve and which supply the muscles of the facial expression, and the nerves comes through the stylomastoid foramina, though it also supplies to the posterior belly of the digastric as well as that of the stylohyoid muscles, but then also the occipital belly of the occipitofrontalis muscle. But we are not dealing with that. We will deal only those muscles which are present on the face, okay? And these facial expression muscles, okay, are supplied by the terminal branch of the facial nerve. The facial nerve, after coming out of the stylomastoid foramina, which is a narrow canal, okay, then it goes and supplies the inside, so it goes inside penetrates the parotid gland. See this is the ear, and in front of this gland, very roughly I have drawn, is the parotid gland. Here the terminal branches of the facial nerve are given, and these terminal branches, they come out through the anterior border of this gland, that is the parotid gland. So from the anterior border of parotid gland, various terminal branches are coming, and we will just very briefly see these terminal branches. This branch one goes which is going to the upwards and forwards. It is called as the temporal branch. It supplies the frontal belly of the occipitofrontalis muscle. It also supplies the upper eyelid, okay, to the muscles of the upper eyelid. Then the second is the zygomatic, and zygomatic also supplies the lid muscles, that is orbicularis oculi, especially the lower eyelid, the cheek muscles. Then the third is the buccal branch. There may be an upper buccal branch and a lower buccal branch, and they supply the cheek muscle and an important muscle, the buccinator muscle, okay, in the cheek. Then this goes towards the lips. Then the fourth branch is the mandibular branch, which is also known as marginal mandibular. It lies close to the margin of the mandible, and this goes to supply the muscles of lower lip and the lower cheek muscles, okay. So it is called as marginal mandibular. And the last terminal branch of the facial nerve, which comes out from the gland, that is the parotid gland, goes downwards and forward and towards the nape, and this is called as the cervical branch, which supplies the platysma muscle, the subcutaneous muscle here, that is the platysma. So these are the different 5 branches: temporal, zygomatic, buccal, mandibular, that is marginal mandibular, and cervical. Buccal sometimes are given the name upper buccal, and that of the lower buccal branches. They are motor in nature. That means they all go to the skeletal muscle fibers, which are the muscles of the facial expression, and supply it, okay, and supply. All our activity or all facial expression, okay, they are because of this nerve, they are. Now in case of some disturbances of this nerve or paralysis, what will happen? The one half of the face gets paralyzed because of the infection of this nerve. The nerve infection may be a viral infection, or it may be compression of the nerve due to viral infection while it is passing through a very narrow canal, the stylomastoid foramina. Okay, and either it may be also due to sometime it is said that high blood pressure may be there, okay, which is responsible, or exposure to the extreme cold may also leads to the this Bell's palsy, which is of course is a temporary Bell's palsy. But most important cause is that the viral infections and swelling of the adjacent connective tissue which compresses the facial nerve while it is coming out from the canal. Now what will happen if there is a Bell's palsy? Immediately you can diagnose that person is suffering from the Bell's palsy because the face will be not showing the symmetrical expression. The face will be asymmetric, and asymmetric is because the one half of the face is totally paralyzed. It is totally, and the whole face, half of the face is totally paralyzed. In another kind of the facial nerve paralysis, which you will learn later, okay, supra-nuclear paralysis is a different. This type of the paralysis where all the terminal branches are affected, where no muscle is supplied in half of the face by these terminal branches of the facial. This is called as infra-nuclear paralysis, and that is the Bell's palsy. Okay. In Bell's palsy, you should remember that almost whole of the face, half of the face, whole of the half of the face is muscles get paralyzed. Okay. Now, when you will see the Bell's palsy or infra-nuclear paralysis, what you will see that forehead will not show the wrinkling, okay? It is flat, okay? When you will ask the patient to raise the eyebrows like that, there will be the transverse wrinkles will be seen, but in the side of the paralysis, there will be no wrinkling will be seen, indicating that the frontal belly of the occipitofrontalis, which raises the eyebrows, is paralyzed, okay? So there are no absence, or there is absence of the wrinkling on the side of the paralysis will be there. And since the branches zygomatic, temporal, they are also supplying to that of the eyelids, orbicularis, oculi muscles, okay. So both the eyelids are paralyzed, upper as well as lower eyelid, okay, and that's why there is a wide palpebral fissure. That means there is a gap between upper and the lower eyelid because of the paralysis of the orbicularis oculi muscle, and the eye remains open. Okay, eye remains open, and since the eyelid are paralyzed, it cannot drain the tears. Okay, which are constantly secreted towards that of the lacrimal apparatus, and there will be the overflow of the tears which will dribble onto the cheek. So the patients will be having the tears flowing onto the cheek. Okay, he has to wipe regularly with the help of handkerchief. Okay, this is tears. This indicates that the mechanism of the drainage of the tears is not there. Okay, towards that of the lacrimal apparatus is not functioning, I mean to say. Then because of the buccal branches which are supplying to that of the cheek, to the buccinator, okay, the whole face will look expressionless, okay, I mean say half of the face will look expressionless, and the nose going to the upper lip and the lower lip, okay, marginal mandibular, they all are affected, so the half of the lips, they are not functioning, okay, half of the lip on the one side is not. And because of that, there will be the effect that because buccinator muscle is gone, which is helpful in the chewing and the swallowing movement will not be. So the food will tend to collect in the buccal space, that is space vestibule deep to the cheek and between the teeth. The food bolus will be, it will be difficult to swallow. It will be difficult to swallow. And since the lips are, half of the lips are paralyzed, and then there will be dribbling of the saliva. He will not be able to stop the saliva, okay, because of the paralysis of this muscle. From the corner of the mouth, the saliva may come out, okay, saliva may come out. And since the muscles of the other half, that is, which is a normal side, they are quite active, they will become overactive. In absence of the half of their muscles, these muscles will become overactive, and that's why there will be wrinkle seen, there will be the eye will be closed, okay, because they are active muscles are here, and then the lips will be raised up. Okay, the corner of the normal side will be at a higher level as compared to that of the lower level here. Okay, and since we cannot make out the cervical branch supplying to the platysma, okay, unless and until we ask the person to raise the, I mean to say, to contract the muscle, that is platys might not. But the face will ultimately will look a symmetric face. And this kind of paralysis, which will affect the muscles of the face, that is the muscles of facial expression, when the half of the face is starting from forehead to that of the chin, which we can look at it, will be asymmetric, and whole half of the face will get paralyzed. This condition is called as the Bell's palsy. It is called as the Bell's palsy. I have just only considered those muscles which are supplied by the terminal branches of the facial nerve. Okay, we have not divided the paralysis, facial paralysis, into supranuclear or infra. That is a different story. I hope you must have understood the Bell's palsy, okay, the paralysis of the facial muscles. Okay, thank you very much for watching this video.